So finally, 4 months later, October 20th, 2021, we're getting around to discussing the pros and cons of vaccination of young children aged 5 to 12 against the COVID infection. I'm going to make this brief. My estimate, without the full drug company information, without the full government information, is that the vaccinations proposed for children will involve the creation of approximately 500 million, possibly 1 billion spike proteins in the body. And spike protein will do a measurable amount of damage, not just in the shoulder and the lymph nodes and the neck, but a certain amount is going to get into the bloodstream and a certain amount is going to get into the brain. So there will be some damage from the vaccination. We won't know the long-term developmental consequences for children, but we have to compare that against the infection itself. And, my estimation, again, without the drug company and the government full information, is that we may be actually producing 100 million viruses during a COVID-19 infection. And that 100 million viruses may produce, or that 1 billion viruses may produce 72 billion spike proteins. So it's almost, it's almost 50 to 1 or 100 to 1 greater numbers of spike protein. And that's not including the rest of the damage that the actual infections cost. The spike protein vaccine is not without damage, but compared to the damage of the illness, which is profound and long-lasting, the risk of the vaccination, the cost of the vaccination is low. Children come in with stiff rib cage and lungs. They can't exercise. Their cardiopulmonary strength is diminished. They come in with hard frontal lobes. They can't think. With the infection, they're knocked out, for months and possibly years. And children may never recover the developmental course towards their optimal growth and development that they would have had before a COVID infection. I see children with glue on the chambers of the heart, and I know they're at risk for sudden death and long-term impairment. It's not just the number of children that die, but the deaths too are significant and important. So apart from whether we stop the pandemic by giving children the protection and the hazards of the messenger RNA vaccines, apart from the issue of stopping the pandemic, we need, as parents and as physicians who take care of children, to advise parents the risk of the illness is far greater than the risk of the vaccine. And our schools have done little to nothing to give ventilation adequate in the classroom, in the cafeteria, in the hallways, to protect children from rapid transmission and spread of the illness. So Dr. Kurlinski here. I haven't been pegged and crucified yet as an anti-vaxxer. I'm not an anti-vaxxer. I'm recommending to the parents of the children that I see in my pediatric psychiatry practice, get the vaccination to protect your children. Last month, I've seen some of my own patients, adult patients, whom I've taken care of for 20 years, get COVID and die. And I can't express the grief adequately in a video. Worse than that, I've seen families fall apart as the stress has now led to suicide and accidental death from parents who suffered losses and can no longer function as parents of young children. We've reached the breaking point in our society for families, for parents, and Suicide, homicide, accidental deaths are breaking families as much or more than the death of parents to children, which, is happening and continues to happen. So, please watch my other videos for more explanation of what we think is going on, with COVID infections. There's better information. Nature magazine has a really good recent supplement of science. Parents deserve more information than they're getting. We as doctors need to have that information. I can't express fully the feelings about our government, the FDA, and the drug companies, which are making tens of billions of dollars of profit from these vaccines, not releasing the full information necessary for the physicians to understand and explain to parents what the real risks are for their children of the vaccinations, and comparatively the 100 times worse risks of the illness itself.